Back now on Triad today, and we want to take time to learn about osteoporosis, a very important topic, and we're going to do it with a very important guest. J. Paul, our director, if we can see our special guest, Dr. William Smith. He's a partner in Brookview Hills Internal Medicine, a Cornerstone healthcare practice, and we welcome you for the first time to Triad today. Good to see you, Doc.
Thank you. Good to be here.
Before we get to the osteoporosis thing, let me just back up a second, and this might sound like a stupid question, but internal medicine, very quickly, what is internal medicine?
Internal medicine is basically the care of adults. We see 18 years old and older.
What kind of care is it? I mean,
it's basically primary care.
Primary care.
Yeah,
okay.
with a little bit more specialization in diseases such as diabetes, hypercholesterolemia, hypertension, COPD.
So you have to know a lot of things, and of course you studied a lot of things in med school, I know, and you have to be sort of the overall guy for all these things, and that leads us to osteoporosis because you can sort of help us deal with and monitor and detect some of these things. So let's start with what is osteoporosis?
It's a disease of progressive bone loss as you get older.
Well, who is at risk? I mean, when you say get older.
Pretty much just in a normal healthy person without a lot of underlying disease processes. Anyone over the age of, say, 50, 55 and menopausal.
Okay.
Also men as you get older.
Well, that was going to be my next question. I was getting ready to say, do men ever have this problem?
Yes. And actually it's recommended that men be screened once you get to the age of 70.
See, I didn't know that.
Yeah.
And
65 for women.
And now let's talk a little bit about some of these ads we see on television. And I'm not going to pick on anybody or do any brand names. We won't do
generic.
that. I mean, who wants to get sued anyway?
Right.
But basically, you'll hear this information. This is going to help you. This is going to prevent this. Take this. Drink this. Do this.
Right.
Can you clear up any misinformation that might be out there? Do all these things work?
You're talking about pharmaceuticals in particular?
Yeah.
Well, yes, they do work. They do work. First and foremost, the things that you can do every day, such as get weight-bearing exercise, make sure you're taking plenty of calcium, make sure you're having your vitamin D level checked, and if it's low, that's being replaced. And everyday things, people should really try to consume about 1,200 milligrams of calcium a day, split up, and about 800 or more units of vitamin D a day.
Now, we hadn't rehearsed this or anything, but I'm just curious, when we talk about, talk to doctors about breast cancer, for example, and they say, well, who's more at risk and should you get checkups earlier if you have a history in your family? Let's sort of flip-flop that on osteoporosis. If a man or woman has a history of osteoporosis in their family, do all these answers you've been giving me, do they sort of shift and go backwards and say, okay, look, you need to get these tests earlier, you need to take more calcium, you need to do this at an earlier age? What about that?
Not necessarily. Just having a history of it in your family doesn't necessarily put you at risk for having it earlier in life. Certainly if you have a family member who developed osteoporosis prematurely, you may want to get tested earlier. However, there are certain disease states that if you have one of these, it makes you more likely for osteoporosis to occur at an earlier age. And things like that, examples would be like rheumatoid arthritis, or if you've had a history of being on steroids for a long time, or if you're a man who has a low testosterone level.
The thing is that there are people say, well, there are certain types of diseases you can get that are manageable, and others, well, I'm not going to do anything about. If you're diagnosed and you have osteoporosis, here's a $64,000 question. If they say to you, Doc, why should I be concerned anyway?
Only because it increases your risk of having a fracture, a debilitating fracture. It doesn't mean that you're definitely going to have one, but it increases your likelihood of having a compression fracture in your back, which can be associated with chronic pain, or a hip fracture, which can be associated with very severe debility, even death within the first year after having a hip fracture.
Now, once you're diagnosed, though, I mean, if left untreated and you're not doing anything to abate it, is it a progressive thing? I mean, does it get worse and worse and worse?
It will gradually get worse, yes. You have progressive bone loss.
So if you're diagnosed, let's say let's say you're 60 years old, you've been diagnosed, you haven't been doing all the things you said, you haven't been doing exercise, you haven't been taking calcium. Very quickly, what do you do at this point?
You get a bone density test and see if you do have osteoporosis or not.
Okay.
And then you can start weight-bearing exercise and make sure you're getting the adequate amount of calcium and vitamin D.
What you're saying, it's never too late.
It's never too late.
Why did we never met until today, so I'm always curious when I meet somebody for the first time, and you're in medicine. What, were your parents both in the medical field? Why did you want to be a doctor?
Neither parent was in the medical field. My father was a policeman. My mother worked in a factory. I really liked science, and obviously everybody says, but I really liked helping people, so
that's great.
Perfect choice.
Good to see you.
Good to see
Will
you
you
too.
come back sometime?